Have you ever stared at a blank TV screen and seen that weird, swirling static? Now imagine if that snow followed you everywhere, all day, every day, even when you close your eyes. That's visual snow syndrome, and it's way more than a quirky optical illusion. I want to break this down because most people, including doctors, have never even heard of it. Visual snow isn't just seeing static. For people with VSS, those tiny, flickering dots fill their entire visual field, in black and white, color, or even transparent. It doesn't go away, not after a nap, not after blinking, not even after staring into darkness. But here's the twist, the snow is just the beginning. Most people with VSS have 2 or more extra visual symptoms. There's palinopsia, where images and lights leave ghostly trails behind, like seeing a car's after image long after it's gone. Some notice the stuff inside their own eyes, floaters, little threads drifting across their vision, or strange dots shooting around when they look at a bright sky. Others see flashes of light, halos, starbursts, or even double vision. And then there's photophobia, lights that aren't just bright but almost painfully intense. But visual snow syndrome doesn't stop with your eyes. Imagine dealing with a constant ringing in your ears, tinnitus, or splitting headaches, brain fog, dizziness, and even anxiety or depression, all tangled up with the visual disturbances. It's a sensory overload that can leave you feeling completely overwhelmed. So what causes it? The truth is, no one knows for sure. It's not an eye problem. Eye exams usually come back totally normal. It's a brain thing. Scientists think it might be down to how the brain's visual processing areas, like the visual cortex, are firing, sort of like a radio stuck between stations. Triggers can include migraines, head injuries, infections, or sometimes just nothing at all. Diagnosing VSS is tricky. There's no blood test, no scan that shouts, "Aha! Visual snow!" It's all about the symptoms static for more than 3 months, plus at least 2 of those extra visual effects. And crucially, the symptoms can't be explained by anything else. So, is there a cure? Not yet. Some people find relief with medications or tinted glasses. Vision therapy and cognitive behavioral therapy can help, especially with the mental toll. But for now, managing VSS is about finding what works for you and knowing you're not alone. If any of this sounds familiar, don't keep it to yourself. Reach out to a specialist who understands VSS. And remember, you're not imagining it and you're not alone. Thanks for watching. If you learned something new, hit that like button and subscribe for more myth-busting health content.